Welcome to Partnership Live, our monthly discussion with healthcare leaders who are changing the health and wellness of our New Jersey residents. I'm Mariekarl Vilceus-Talty, and I am so pleased to be joined today by Mildred Menos, the Director of Medicaid Outreach and Advocacy. Hi, Millie, how are you doing?
Hey, Mariekarl, I'm doing well.
So nice to see you again. Thank you so
Yes.
much for participating in our maternal health and perinatal safety symposium. Your team was really spectacular, really spectacular. Thank you.
Oh, it was our pleasure. Thank you so much for the opportunity to share about what we do and, give sort of the unique payer perspective on that.
Yes, which is very, very important. But, before we get into that, because, I really want to dig into that. I know you've been working with Horizon for a couple of years and you've been in healthcare, but if you were doing this and working in healthcare with Horizon, what would be your dream job?
Okay. So I think that I have a more fanciful answer and then maybe a more practical answer. So if ability wasn't a factor, I grew up as a competitive athlete, and I'd love to just be able to go back to playing tennis full time, which is how I grew up. But maybe on a more practical level, before coming to Horizon, I worked in grassroots patient advocacy and I loved it. And so I could definitely see, being able to really get close to the patient population around one specific condition in that way. Again, it's incredibly rewarding.
Oh, that's very nice. And let's not be practical.
Right.
To win and just be fanciful, absolutely. But you've always been working in advocacy, which is really great. So let's get down to the nitty gritty. I have so many questions about Horizon and the payer. As a health insurer, I know that Horizon is working really diligently. Tell us about how they are working to change the paradigm with maternal outcomes.
So maternal health, and I'm speaking to the absolute right person here when I say this, it is at a critical, very sobering, scary place right now, especially in New Jersey. We have such a large percentage of the membership in New Jersey that with that outsized population, we really have an outsized responsibility to address something that is so broadly, not only in our national conversation, but in our state and local conversations as well when it comes to population health. And when we talk about maternal health, it is not just the health of expecting individuals. This affects any children they may have, their spouses, their families, and all of those folks are our members as well. So we really take it quite seriously. And with the cooperation of the administration, who has also put this in their platform, I think that we've been able to do a lot of things in a fairly short amount of time to expand access around maternal health services. We are looking at maternal health in a multi-dimensional approach, right? The issue of maternal health isn't just one thing, it's varied. There are multiple stakeholders and multiple areas that it affects. And so the approach is multidimensional as well, right? So on the grassroots level, you'll see my team out in neighborhoods all over the state with our pop-up baby pantry. These are events where we give away diaper bags that are full of baby essentials such as diapers, formulas, wipes, all of your starter essentials that are frankly expensive and hard to come by. We just recently went through a formula shortage that was devastating. So we want to start people off on the right foot, and we're not trying to just give those items away. We're actually trying to engage in conversation as well there, right? Asking them, do you have the coverage that you need? Do you have the support that you need? Do you have questions and concerns about your prenatal care that we can help connect you to resources about?
Right.
That's one thing, right, out in the street. And then also we have a partnership going with the Motor Vehicle Commission, which sounds a little unusual, I know.
I was like, oh, really? Okay.
Yeah. If you think about it, having a state ID is your passport to so many benefits, right? applications will require that ID number. If you're applying for housing or any kind of support programs, often they'll ask for an ID. And with the partnership at the family fall festivals that the First Lady's office sponsors and runs around the state, the Motor Vehicle Commission will bring a mobile unit. And so we will cover the cost for first-time state IDs and also the renewals of them, also for expecting individuals and their families.
That is just so spectacular that we're looking at the whole person. I want to get to a point where, back to a point where you said it's not just maternal health, because maternal health is population health, and that's what we have to keep on the frontal lobe. But I do want to get back to your title. Your title is Director of Medicaid Outreach. So does that mean that you only work specifically with the Medicaid population, or does specifically Horizon do a lot more outreach to other MCO participant members?
So Horizon houses all of the lines of business of insurance that one could have, right? So we have employer-based insurance, Medicare, Medicaid. I sit in the organizational structure of Medicaid, but when you think about the social impact programming that community outreach teams such as mine do, these are not issues that are limited to a Medicaid population. When we talk about food insecurity, housing insecurity, and what we're here to talk about today, maternal health, these are not issues that are concentrated or unique to the Medicaid population. And so when we do health education, when we do resource connections, we don't have a bouncer at the door of the events checking ID cards in your line of business. If you need help, we're there to give it. And so a lot of what we do cuts across the populations because the issues that we work on cuts across the population.
Mm-hmm. Very, very important. So I, as a consumer, I'm looking for a specific provider, maybe someone who looks like me, speaks my language, is proximate to my living arrangements. How does that affect the care? Because we're going from one provider to another, but you're looking at the needs, the complete medical needs from a different aspect, a different scope of care. So how does that inform your efforts to improve care?
So exactly right. In a lot of our healthcare stakeholder systems, right, we can only see what we see. One pharmacy, one doctor, maybe even one health system, which tends to even be more integrated than most. Mm-hmm. But although people may go to various health systems or different pharmacies, they usually run all of their medical care through one insurance. And so we have the opportunity to see someone's full spectrum of medical care and need. That allows us to trend what's happening. For example, someone may be checking in to various ERs on a very frequent basis. If they're not in the same system, they may not know how often this person is seeking urgent medical care, but we can see it as the insurer. And so that's an opportunity to say, wow, this person is really going to the ER quite often. What's going on here? Are they medically complex? Should they be referred to case or care management? Mm-hmm. Are they in need of some social navigation, right? So we have a community health worker program that may help them with some of those social determinants of health. Is their living situation unsafe in any way, right? So we have a program within Medicaid called Managed Long-Term Services and Supports that seeks to keep people in a home-based setting by addressing any difficulties in that home-based setting. Do you need a ramp? Do you need meal delivery service, right? So our goal is to improve the environment that people are in, and we can do that because we can see trends in the type of care that they're seeking, no matter where they are seeking it.
Right. So it's having that 360-degree view. So when you're talking about community outreach transformation, these are the practical implications that really are proving to make sure that the community and the members are safe and that they're well, not only the foundation, but the scaffolding. Can you share a little bit more about the community outreach transformation programs?
Sure. So we do a couple different things there, right? So there's several parts to our team. So the first part is probably the most obvious, right? We are a health insurer. And so first and foremost, our expertise is in insurance and insurance coverage. We are going to be the people that are out there in your neighborhood explaining what Medicaid is, how you may be eligible for it, maybe breaking down some myths and stigma around eligibility or accessing Medicaid. I think that there are still many places and pockets within New Jersey that people are embarrassed or feel like Medicaid isn't for them. So there's a lot of education that goes around in it, and a lot of reassuring people. Because you've signed up for Medicaid today, it doesn't mean that you'll be on it forever, right? It's there to serve you in the season of your need, right? And we hope it's a short season, but if it's a long season, that's okay too, right? Because any one of us at any time could have that rug pulled out from under us. No one is above, something unexpected happening to them and needing that social safety support. And that is what Medicaid is. It's really there to embrace us when we're down. And so, that navigation is sort of the heart of what we do, getting people coverage, helping people stay on coverage, right? There's an administrative process to health insurance that can be quite daunting. If English is not your first language, if paperwork is not for you, if there are barriers to technology and accessing technology. So we have a lot of people here who are very skilled in the application process and the renewal process. We're here to sort of break it down for you. So that's one part. And then, once we're helping you apply, we're also telling you, wow, this might be the very first time that you have insurance. If you've never had insurance before, here are some of the things that you can do now. Instead of going to that ER, you now have a primary care provider assigned to you. Did you know that you can go regularly now? You'll have dental care.
So very important, especially during the maternal period.
Absolutely. So that benefits navigation and, sort of how to get and keep coverage is at the heart of it. And then there's the other part, right? Because we sit in Medicaid, I think we have a unique privilege in being able to address the full spectrum of whole person health. We are talking about, right, so health education. We have a team of health educators. I know some of them have worked with you and been here on live before. They're amazing. And they serve all of our community partners. I think that's another thing I should point out, that we never will be out. You'll never see us out by ourselves. We always work as the invited guest of a community partner, such as yourself. It could be a faith-based organization. It could be a school or a provider's office. What we'd like to do is just lend the expertise that we have in this area to support the good work of the folks who are in communities day in and day out, who are trusted and credible messengers to the residents of that community. And let us just help with the paperwork, right? Let us help connect you to the care and the resources and navigating the systems that we acknowledge can be really complicated sometimes.
And because people, they're like, oh, I don't want to do this whole insurance thing. It's just so daunting. But you have boots on the ground in several different languages and several different communities to help us do that. So when we talk about communities, as you know, the partnership is really committed in increasing access to community doulas. We have our community of caring doula cooperative in Patterson, and we have in the greater Newark area also. And we'll be moving into Hudson Union. What initiatives do health insurers have right now that they're leading the way to reducing the barriers for doula care? What do you have?
So I think doula care and its expansion, especially in the last several years, is one of the most exciting things and advances in maternal health care to come into the payer space. So doulas traditionally work in a private pay world, right? They are, working with clients one-on-one, or they may work in a community setting. But when people think about accessing their medical care and what medical care is available to them, very, very typically, the first thing they do is they look at their insurance. What are my benefits? What's covered? Who's in my provider directory? And up until very recently, doulas were not there. And if you're not providing, if you're not giving providers the opportunity to be accessible to people in the way that people seek to access medical care, then you're really doing a disservice to the benefit that doulas provide, being accessible to the people that probably need it the most. And so it is not easy to bring a benefit that is a very different provider type into, an insurance structure. But I'm very proud of the work we've done to make that benefit and that service that doulas provide more accessible in the way that people like to access things. And in doing so, I think that we as a company have changed and expanded our vision of who providers are, of the care that people need, right? They're not all going to be the typical medically licensed providers. In the spectrum of whole person care, there is room for a lot of alternative provider types, doulas being just one of them.
Right.
We also see the rise of community health workers, right? And so changing and tweaking our systems for different types of credentialing, for different types of payment structures, I think has been the work that we have done on our end to make our systems evolve with the way that care is evolving and the needs for care are evolving. We have brought in doulas on the Medicaid side for several years now, due to not because of us, because of changes in the state contract. But just this year, on January 1st, Horizon became the first provider in the state to have doula services accessible to our state exchange population. And it's really important that it was this population, because those folks on the marketplace are the ones who tend to flex in and out of Medicaid coverage. You have one change in a job or one change in salary, you might go in and out of Medicaid coverage. And so you're very vulnerable also. And so providing the doula services there, I think, was a great first step. And actually we're in active talks to expand it to the rest of our commercial populations. And we have a lot of interest from employers right now about how they may offer this service to their employees as well.
It's such an important service. It's really about keeping people well, keeping the population well. And you said about having new therapies and embracing new therapies of care. Can you talk to us about that? Because, at the partnership, we cover the 8 counties in the north, and we work with many of our hospitals, our physicians, our nurses, our anesthesiologists to really support the job that's happening within the episodic care of the hospital encounter. But I know as a healthcare provider and insurer, you're embracing new therapies to ensure that maternal mortality and morbidity is being reduced. So can you talk to us, share with us what some of those new therapies are?
Certainly. So we're looking at all of the things that may come into someone's birth journey. So prenatal and postpartum. We are looking at what we can do around lactation support, around nutrition during the pregnancy. We have many people who are coming in to pregnancy with medically complicating events, right? And so as we think about how to keep them healthy in order to ensure a healthy delivery and a healthy postpartum experience, right? Part of it comes with making these alternative services less alternative and more mainstream. And part of it comes with working with our provider partners, because it's not just about us and our members, right? It's also about the health systems that support them more broadly. So our physician partners, right, making them aware of what we're doing, how we're trying to advance this, letting them know your patient may come to you and talk to you about some of the benefits that they're now seeing on their insurance. We'd like to make sure that you're educated about it as well. And on their side, we're seeing some health systems that are becoming quite advanced, right? There are a number of health systems that have fully embraced doula care. We know that hospitals have really made a turn towards providing more robust lactation support. And, as well, I think that we can't have a conversation on maternal health without addressing the role that systemic race plays, right? So systemic racism. So we offer all of our providers in our network implicit and unconscious bias training. And so we have rolled that out over the last year and have had hundreds sign up. And I think the reason it's not thousands is because so many of those health systems are already offering it within their system, right? So it's a good problem to have, but we know that not all providers are part of large health systems. So we want to make it available to everyone in our network, whether you get it at your home system or you get it through us, to make sure that this conversation does not fall by the wayside and it's front and center when people think about care.
I think this is just such an excellent conversation. So if we can drill down to the individual, say I am newly insured, don't know who to pick. How would I get into the Horizon Network? Is it a navigator? Is it from my physician? Do I call a 1-800 number? Like, how do I become part of the Horizon Network and start to reap some of these benefits?
So as a member or as a provider?
Let's start as a member and then as a provider.
So as a member, right, I think your first step would be to determine what line of coverage is best for you. So if you're employed right now, you might receive coverage through your employer. It's a fairly easy process. The employer walks you through it. If you are not employed by someone who offers insurance benefits, but you're making, a substantial amount of money, the state exchange, marketplace might be for you. You can go on our website, horizonblue.com, and search your options there. If you think that you may be Medicaid eligible, frankly, even if you think you're on the borderline of being Medicaid eligible, I would really encourage you to fill out the Medicaid application. I think something that people don't understand is there are certain populations that have higher eligibility thresholds for Medicaid eligibility, so higher income thresholds. Children are 300% more eligible than adults. So although you may not qualify, maybe your children do. Okay. If you're pregnant, right? Pregnant individuals have higher income eligibility thresholds. And there's been a very landmark extension of coverage in New Jersey. New Jersey was actually the second state in the country to extend postpartum care on Medicaid to 1 full year. So we're very proud of that. We're proud to be a pioneer in that. And so for someone looking to have continuous access to care, not only through their prenatal journey, but through their postpartum journey, which is frankly when most maternal mortality occurs, we want to make sure that you are covered, that you are safe, and that you are really in the habit and have access to that continuous network of whether it's your primary care physician, your OBGYN, or any specialist you might need.
So Millie, can I stop you right there? As an individual, if I just delivered, this is my postpartum period. So now I'm hearing about the universal home visiting procedure that's happening now in New Jersey. Would I need to call you and say, hey, am I covered for this? Or do I just automatically roll into the coverage?
So for accessing Medicaid eligibility, you do need to formally apply, right? So eligibility is determined by the state of New Jersey, but our team could help you with that, right? And there's a lot of ways to apply. So the application is actually online, and that program is called New Jersey Family Care. So you can apply online. If you meet any one of our representatives in the community, we'll help you apply in person. We have application assistance events going on all the time. You can also reach out to us via email at hnjhanswers@horizonblue.com. And lastly, the state has many resources also. So they have a telephone number of care coordinators that will help walk you through the application telephonically. Maybe computers aren't for you, and you want a little bit more hands-on help, right? So there are folks that will help you telephonically also.
Excellent, excellent. And as a provider?
As a provider, so if you're interested, and I'll kind of speak directly to the doulas now, because I think this is one of our most, what we call a panel, right? Our most open panel of provider network right now. We encourage you to reach out. We are building our doula network both on the Medicaid side as well as on the commercial side. And so having, from a business perspective, doulas have, completed their training, they're certified, they're ready to work. We have a lot of members. We invite you to come in, fill out that application on our website. You just click on the tab at horizonblue.com for providers, and fill out our application to become a provider in our network. And we've actually tried to make it really easy. It's one application for both networks. So trying to streamline the process.
That is really excellent. I've really enjoyed speaking to you. We're going to have to do this again because I know so many people will have so many questions, not coming in now, but I'm sure there will be questions in later that we'll have to have you back. But before we leave, I do have another whimsical question for you.
Yeah.
So seeing your life experience now professionally and personally, if you were to write a book, what would be the title and why?
I think the theme of my career, because I've had several different parts of my career. I started in academia, went to grassroots patient advocacy. I'm now in a more, quote unquote, corporate side. I've constantly been on a learning curve. And so the title of my book, I think, would be Get Uncomfortable, because I've always been in a state of discomfort, but I think that you can really thrive there. It makes you ask a ton of questions. It always makes you humble. And I think those, being curious and being humble are two qualities that will serve you well, even if it is a little bit of an ego check for a while.
Absolutely. Wonderful. Curiosity does not kill the cat.
Absolutely.
Thank you so much for joining us today. I really appreciate our conversation. I look forward to speaking with you again.
Thank you so much.
And thank you for joining us for Partnership Live. And I look forward to seeing you next month. Thank you.